I didn't know this. July is National Cleft Awareness Month. We want to go ahead to talk about this and so many other things. Dr. Lamont Jones from over at Henry Ford West Bloomfield. Great to have you with us, Doctor. How are you?
I'm doing great. Thanks for having me today.
So I didn't know it was National Cleft Month. Tell us more about that.
Yeah, so cleft lip and palate is the most common congenital abnormality or the most common issue that kids are born with in the head and neck area. It's about 1 in every 600 births, live births, and it's a condition that gets a lot of notoriety. If you look at some of the advertisement that are done international, there's a lot of people that travel to help other countries, people in other countries that don't have access to type of healthcare that we have. And so a lot of people may think that it happens more abroad than here in the U.S. But again, it's 1 in 600 births. It's definitely something that's important to raise awareness about.
Yeah, I remember back in the day they had that program. I think it was called like Operation Smile, and they would have the TV commercials on. And with that, so are you saying it happens just as often here in the United States, but maybe we're not aware of it as much because we do have the medical system that can help so many of these kids?
Well, when you look at, so there are different ethnicities that are more likely to develop cleft lip and palate. It's a multifactorial problem, meaning that there are frequently multiple things that have to happen in order for a baby to develop a cleft lip and palate that are outside of a parent's control. One of the things that can help is multivitamin U, some of the standard prenatal care issues. And so some countries, obviously, they don't have access to those things. And so there could be a little bit of an increased incidence related to that. But the point is that it's still pretty frequent, even here in the U.S. And, because, we don't see those late night advertisements for donating money for these different mission organizations, people may not realize that it does happen here in the United States.
Dr. Lamont Jones with us here on the MegaCast. He's with Henry Ford West Bloomfield at Ears, Nose, and Throat. Doctor, how'd you get into this specialty?
So, like a lot of things, there's usually a lot of overlap when it comes to taking care of conditions. An example is, you may have a spine surgeon that has neurosurgery base training or orthopedic base training. For cleft lip and palate, traditionally it's taken care of by plastic surgery, but there are overlap with persons like myself that have an ear, nose, and throat background. I have special training in facial plastic and reconstructive surgery. I'm specifically doing congenital abnormalities. And so when I was in my training, I was really drawn to the difference that you can make by doing cleft lip and palate surgery. And so there's a lot of different things that I do, but by far, cleft lip and palate surgery is the most rewarding, one of the most rewarding surgeries that I do. It also gives me the opportunity to travel the world. And so I've been to, quite a few countries doing cleft lip and palate surgery. One of the places that I mainly go to is it's a city in Kenya called Migori. As part of an organization called Kenya Relief. And I was fortunate that back in, I think it was 2016 or 17, it was featured on a 1 hour special on Channel 4 WDIV. And it received a local Emmy Award for the care that we gave to the kids there.
I remember watching that because I think I remember one of the nurses that went was in the gym I went to, and her talking about the experience that she went through, because it's not only life-changing for the kids, but also life-changing for some of the members of the medical team that goes as well.
Yes, I mean, I think, COVID is a good example of, we I think people outside of healthcare may not appreciate the calling and the benevolence that people that go into healthcare, and doing mission trips is an example of the activities that people do to give back, and they go over and beyond. Most of the mission trips are self-funded. You have to use your vacation. There's sacrifice, being away from family and friends, and similar to how people stepped up in the healthcare community during COVID. Mission trips is another example of what we do every day to try to make a difference.
So with that, Doctor, can I ask, have you been able to do any of the mission trips throughout the pandemic, or have they been put on hold right now?
So they were put on hold. I know that the organization Kenya Relief has started back. I have not had the opportunity to rejoin any of the mission trips. I'm hoping to get back involved in the very near future.
So talk a little bit, can you share with us some of the stories of the kids that you've operated on? Have you been able to go back and visit them or check in with them years later?
Yes, there's this is an organization that's been around for about 15 years. They have a really, sophisticated setup where there's long-term follow-up for patients. And, soon after doing surgeries, there was frequently communication between, the clinic where we operate at and myself and the other surgeons that operate there. With the new technology, I think, again, COVID helped to highlight telemedicine. Before, COVID, we were still doing things that could be considered telemedicine. And it helps us and has helped us stay in contact with patients that we give care to.
So, Dr. Jones, can you kind of tell us, when you go overseas, we do know that, the setup in the medical, setup is so different than what it is here in the United States. What challenges do you face as the surgeon when you go to some of these other countries? There
are patient challenges, there's personnel and equipment challenges. One of the biggest factors is the pre-surgical assessment is very important. A lot of times the surgeries are routine, and, a lot of the things that I do when I go away aren't risky within themselves, but, not having adequate history or being able to order, sort of routine preoperative tests can pose a problem. When we first started going to the mission trip in Kenya, there was one room with two operating tables. Sometimes we had to share a suction machine between two patients, or a Bovie machine to stop bleeding. But part of the surgical training, you learn how to do a procedure. You learn about the potential of unaccounted for abnormalities, or how to deviate from the plan, on the fly when necessary. And so that is part of the training. When you go there, you expect that you're going to have to improvise at times. But the one thing that I can say is that, the goal is to do no harm, and we never compromise the care or patient safety. So we use what we have to make sure we get the same or similar results that we would get here in the United States.
Dr. Jones with us here on the MegaCast from Henry Ford West Bloomfield. Dr. Jones, can I ask you, I know that I did a mission trip a few years ago to Kenya, and when you go over to another country, you look around with kind of, seeing their country, but also looking at our country, and you feel so wasteful. We have so much compared to some other countries. How did you react to that? And when you're going over, and, for us, we just went as a mission trip, we built a dorm for rescue girls, but you're actually going into the medical field and seeing the difference between the setup between the two countries. How does that impact you?
I think that when you have experiences like that, you can't help to be changed. I, what I've tried to do each time I go is to grow as an individual. You want to be thankful for what you have and the opportunities, but I think that you shouldn't be complacent, because there's always opportunity for improvement. You know, the mission trip is sort of supported by donations from at least when I went, the donations from the Metro Detroit hospitals. I think it really reinforces what we can do when we have a common goal, and we're not thinking about a competition. And so for me, it really reinforces the good of humanity, and that our basic instinct and natural reflexes to be of service and to help people.
I know that you are also a researcher, but you're also dedicated to teaching the next doctors. What advice would you give them if they're thinking about going into your line of surgical needs?
Yeah, I think a common advice would be to put the time in. It's most of the time you're going to get what you put into something. I also think that people should go into it for the right reason. I mean, you have to be willing to want to help and serve people. Being a physician, surgeon, like most service fields, that there is a personal commitment and personal sacrifice that has to that accompanies the position, and that starts from undergrad, medical school. You're going to miss out on some things. You have to put others before yourself at times. Those would probably be the two biggest things, to understand the commitment and the effort that's necessary, and understanding that going into the healthcare or service field, it's about how you can help other people first.
Dr. Lamont Jones with us here on the MegaCast. Just another minute or two before we say goodbye to you today. Anything maybe that you want to share with our listeners and viewers that maybe I didn't touch on?
Yeah, I think people should read up about cleft lip and palate patients. I think one of the biggest issues that they face is some of the stigma of the defect. Whenever you have something that affects the face, it's hard to hide, and we know that, especially as a young child, there are self appearance and self-awareness things that are important, that help shape your future. And so I think people should be educated about it so they can be supportive. If a kid has a classmate that has a cleft lip or palate, it would be important for the parents to be able to be able to speak about it and help encourage their children to be accepting, just like we would do for any thing that makes you sort of stand out or different.
How many surgeries do you think you performed over your career thus far?
Well, surgeries, I mean, I've probably performed 6,000 or 7,000 surgeries probably over my career. I mean, we do about 150 to probably about 300 surgeries a year. So I would say 300 a year. I've been doing this. If I include training, I've been doing this almost 20 years. So I would say somewhere around 5,000 or 6,000.
Think about all the lives that you have changed. You really are a superhero walking amongst us. So thank you for being on the show with us today.
Well, thank you for having me, and thank you for the compliment.
Hey, where can people find out more information if they want to, just in general?
Yeah, I mean, if they want to find more information about myself and some of the things that I do, even cleft lip and palate, I mean, they can go to the henryford.com website, and there's a Find a Doc tab, and they can put Jones in. There are not a lot of Joneses, and they can find my website and see some before and after pictures of some of the patients that I've had the honor and pleasure of treating over the years.
Well, thank you again for being with us. We appreciate your time today.
Well, again, thank you for having me.
And I love the fact that he mentioned that parents really need to talk to their kids about this, just like we would about other things, with our kids. And if we can, let the kids be open and honest about some of the issues, especially when it's your face. Yeah. We know that when you have something that impacts your face, it can be very hard on the kids. So it's great to have that conversation with the little ones. Again, Dr. Jones with us here on the MegaCast, Henry Ford, West Bloomfield Hospital.